Hello. Did you hear that?
Oh,
Hello.
yeah.
It's awkward.
Mm.
Today we're talking about awkwardness in the dental office. Why is it such an awkward experience?
Oh, I thought it's
What was it?
awkwardness around dentistry,
Oh yeah.
mm.
Oh yes.
Even outside the office.
Oh yes. Oh spicy.
Spicy, everything.
Oh yeah.
Yeah, I mean, because like it's still awkward to tell your friend, like, friend, you should probably see a dentist. Like, how do you tell somebody with like,
Yeah. It insinuates a lot of stuff. You know. Like
it insinuates? I mean, it could be true.
it could be. It
Mm.
could be. It could. Most of the time it is, but
Yeah,
but the underlying messages. This is the intro.
this is the intro. Is it awkward? That's the plan. Just to show like it's a subjective thing. It's a feeling. Like when you're on the street and someone's like, "Hey," and you wave back with enthusiasm, and they were not greeting you.
Ouch,
Mm.
emotional damage.
Yeah, but is it really that bad? You really thought it was you, and it wasn't. But it's not embarrassing. There's no reason the earth should open up and swallow you. So we'll also discuss that a little bit, just to show that the feelings you might feel around something is not always factual, and then it always doesn't mean something bad. I'm Craig.
And I'm surprised.
We'll be talking about awkwardness. You know that series, Awkward?
No, I don't.
It's American.
Uh, do, 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 do.
Can you shut up?
So, where would you like to start about with awkwardness? In the office or outside the office?
Let's start out in the office.
Mm. So, one of the most common things is I hate dentists, people being shy about dentists, you know, see it all the time, you know. It's just that I'm so beautiful and good looking, and I tell such
You
great
are.
jokes that we squirt through it. I'm joking, that was lies.
No,
But
that's true.
really,
You're a gorgeous man.
but we do get a lot of people feeling a bit ashamed and insecure about their mouth and insecure to open. And why is that the case?
I know, because like it's a public thing, like your mouth, like people see it, but at the same time, people see your face, people see your hands, which are public, people see your hair. Uh, but then again, it's the mouth that gets pretty awkward. Uh, Someone said it's probably because you use it for a variety of personal things like eating. It's personal. Your hygiene can show as well, quite personal. You kiss, you tell your mother you love her. Uh, you know, it's a very intimate thing. So like people can be pretty sensitive about it. And now there'll be a stranger with their fingers in your mouth, moving around and everything. So it can make it a little bit, you can feel vulnerable, especially if you don't really know the person that much. It's your first time, like open wide. Oh, okay. All those sounds that we make. And I'm guilty of that. I make sounds, and usually it's because I'm thinking, and I'm like, okay, this could be this, not because like, ooh, I ain't never seen a mouth like this before. So it can be interpreted in many ways, but that's why I think it can be awkward. Yeah.
Yeah, no, that's true. First word of encouragement, you know, because we always try to keep things encouraging, is that, you know what? If you think your mouth is bad, we've probably seen worse.
We've definitely seen worse.
So do not think this is the worst you've seen. Because if you think yours is bad, no, it gets real bad. You know,
Yeah, and that's a common question we get asked.
is this the worst?
Yeah.
I'm like, no, no. Like in dental school, I think you will get exposed to the worst.
Yeah,
Probably the worst experiences.
but like
Outside,
outside in private practice and like it's not so much. People are pretty just paranoid about it, but definitely you are far from the worst.
indeed. So I think another thing is the way dentistry is, right? So when you go on the chair, you're lying down, your mouth is up, you're looking at somebody straight, like it's crazy. You're looking at them like from this position. I mean, it does.
Too submissive.
Yeah, it's a weird position to be in. I won't lie. I mean, I ensure I get my cleanings done every 6 months. And when I do it, it's like, wow, this is what the patients see, and this is what they perceive of me every day. So I can understand why somebody might feel awkward just saying, I have to wrap my head around going to the dentist. Sometimes going to the dentist might even seem like a workout you don't want to do because it's like, oh my gosh, but the positioning is quite awkward. On top of that, all the instruments we use, the taste, smell, it's a lot. It's overstimulating, and I can get why that can be a bit awkward for some people. And if you've had multiple failed procedures, because that, or you've not had the best experience with dentistry, you can even add to a layer. Can even add a layer to that awkwardness.
Yeah. Another one is because it's like since you were a kid, you were told to brush twice daily, floss, take care of your teeth. And if you fall short of that, you have cavities, you have plaque buildup, or like random dental problems, it feels like you failed as an adult at like a basic thing that you should be able to do. But what we don't say, like although you are brushing twice a day, everybody's teeth are different. You having more cavities than your friend or having more plaque buildup than your friend is not always a personal failure. But that level right there, we're like, oh, they must think I'm nasty, or you feel like you are, but like again, it's just a perception of what you might, you know,
What you might think.
what you might think.
And here's something weird. Like I saw recently a patient who does all the right things. I'm like, all the right things. The brushing, the flossing, and had like multiple cavities, multiple extractions. So it's not a personal failure if you've had a couple of teeth extracted, or if you've had a root canal, or if you've had a bit of calculus build up. It's not a personal failure. Sometimes it's just a case of your body just being different, you know. So yeah.
Exactly. Also money, because
Oh.
like dentistry is expensive, and it can be quite scary. Like, oh, okay, you'll need this, and you'll need this, and need this, and this, and realizing you can't afford it, and then you have to explain to a stranger your financial situation. Like, oh, is there like a payment plan? Can we? Because I don't have that much money, and like so some people do have like different feelings about it. Some might feel shame or embarrassed that they don't have like 12,000 rands on the spot to do a certain procedure, while others might be just doing it. Again, it's not a competition. It's just, yeah, it's just life. It's not success or failure on your end. It's
Indeed.
just humanity.
Yeah, that's true.
existence. Yeah.
Because like we all have different financial situations. And sometimes you might be like doing amazing financially, and then things just suck.
Yeah.
And when things suck, your teeth might suck at the same time. So things suck.
Yeah.
And then it's like your teeth are acting up, and your money is acting up, and it adds stress and makes you feel like, oh, you dread coming here. But again, I don't think anybody's judging. I mean,
No.
I don't think anybody judges here, because if anybody judges, maybe they've not had financial issues. And I think most people have had some type of
But it's
financial.
only a matter of time,
Yeah.
really, before they do. We all will.
Yeah. So, yeah, I think that's a word of encouragement again.
On another aspect, things we might do as well to make you guys feel worse is we're taught like the technical terminology. So I'll say something like you have plaque and calculus and you have cavities. It sounds almost caries.
Caries.
You have caries and you have this, you have this. It's almost like well, like it's on you. You have this, you have this, you have this, and it just becomes like heavy. We could probably phrase it better that you might be experiencing like a biofilm issue where your teeth attract more plaque than necessary. So it's not you, it's the villain is the plaque, it's the calculus, and that's what we have to deal with to remove it so you go back to being awesome you. So like I think some of the wording just puts way too much load on the patient sometimes and we're detached from it. But it's the word in itself, it does feel detached to us, and it feels like we're explaining the technicality of it, but the recipient might feel otherwise judged,
I've
critiqued.
noticed that most patients who come not being happy about a previous dentist or previous dental experience Actually, I'm not happy. That's not the main thing. I think the main thing was the communication, right? And communication about what's going on with them. For example, people who get cavities really quickly, communication about what actually they need and why they need it and how it can be phased. Like the communication is not done effectively. Again, I'm guilty of this. I mean, I'm not gonna, say I'm not because it happens. Things get busy. You have a consult. You just want to get it done so you can jump to the next thing.
So you drop the facts.
And you just drop the facts. Like this is what you need to do. Bye bye. Or sometimes
Yeah.
you've got like a complicated procedure that you're coming from, and your mind is still in a bit of a tiz, if I can say that.
So we forget our bedside manner.
Yeah, you
sometimes.
kind of slip a bit, or the next procedure you're gonna do is a difficult patient, always a difficult one. So you kind of skip out, on the communication and just like rush into like getting into the facts and not like, what is this? Buttering up the bread, because it's not that we're buttering up, it's just that it's quite, again, multifactorial stuff.
Yeah.
So you kind of have to layer it in conversation, if I can put it like that.
I heard something about like people who are blunt. You know, like oh, I'm just a straight talker. I'm just blunt. I just give it how it is. And then someone replied, I think I'm not sure if it was a movie or like something that like what's the point of you saying something when the person won't actually receive it? So like your communication is now, or it was just for you and your satisfaction. Because if you're going to communicate with someone, at least make sure that they're getting the right message so that information can help. And I guess sometimes it takes a paradigm shift in how you word things and express those
Indeed.
things.
Indeed. So I think we've covered the office.
We've covered the office.
Yeah. 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 And also front desk staff and assistants and all that stuff, they do make it weird sometimes. But again, remember, we're just human.
We are.
We're just human, okay?
Zero
I am
judgment.
only human after all. That's a song.
I do know this song.
Yeah.
I almost sang it too.
And then outside the office, all right, it is a bit weird. In fact, you will not hear this. I find it weird to be outside the world doing what I do because, again, I'm never gonna say these words. I do see issues with people's teeth. I'm sorry. I'm not that guy.
Yeah, we see it a lot.
Yeah.
And I guess you like to draw the line. Like if we're at an event, I can't just like, hey, it's such a great party, right? Yeah, calculus buildup. You should go get that clean yourself. It's so it can be, but like if someone has had that much buildup, it probably also means no one around them is telling them, right? And so, is it our responsibility to tell?
No.
Is it their friends?
No, it's their friends. There's a lady who can actually smell Parkinson's or Alzheimer's, something like that. Right? She can smell it.
Kim Kardashian can smell caries.
Yeah.
She said on a reality show.
Yeah.
Not that I'm keeping up
With the Kardashian.
but she did say it.
But this lady can smell like people who are going to develop Parkinson's, and she doesn't tell them because it's like it's not her place to tell these people, right? And yeah, very interesting. Yeah, so she can smell it in public. She can smell.
Ooh, yeah.
Yeah, like she can go to an airport and smell. Oh, this guy has Parkinson's, and in a couple of years, it's a fascinating story. Her husband had Parkinson's, and there was a smell she noticed, and she notices that smell all the time, and it's a whole thing. You can look up on the internet, right?
Also have like spiritually awakened friends. What's the word? What's the word?
I have no idea.
Spiritually inclined.
Yeah.
Spiritual. What's the word? Spiritual. My close.
Yeah.
Like
Yeah. So
like Sangoma.
Yeah.
So like they would have like visions about a person or impressions, and mostly they choose not to share them because
Indeed.
it's creepy. You
Yeah.
know?
And
So, I guess it's the friend's responsibility
Yeah.
in this case. Like, hey friend, what do you see when you smile? I'm kidding. I don't know how do you tell that? How do you deliver that to a friend that you love? That friend, I think you need to go clean your teeth at a dentist, but in a polite, zero judgment, I just care for you way, and I don't want you being in awkward situations in like an interview or like a intimate relationship, and like that is the one thing that puts off another person. I
Yeah.
don't know how you can bring that up. I guess you would have to like judge the friend and how you guys communicate and how comfortable they would be. But ultimately, if you are a close friend, not like I know them, but like if you are like besties or something, I think it would be good to tell them, you know?
Indeed, it would be, again, it would be good in the ideal world, but we know things are not ideal, right? So please do this with caution, because there are people who don't like to be told stuff like that, you
Yeah.
know.
It's
Totally
such a
understand.
subject.
But again, it's like it's the equivalent of, your friend has their fly open, just gonna let them walk around and say, hey, tell them like, hey man, and I think that's kind of the approach we should start to adopt with friends and family outside of dentistry, like in all things like health related. Like, you see a friend of yours with a little growth, say, hey man, like please get that checked out. That help, because these things really do help people. They really do. And you can save somebody from gum disease by doing that. Again, I don't know what to say, because even I find it
I mean,
hard.
it's about as touchy as, hey, friend, like, are clothes getting smaller or you're getting bigger? It's touchy.
Yeah,
It's
it's
like,
fine.
you need to start working out or something.
Yeah.
But again, you should navigate this well. You're adults.
Yeah.
And if not, just keep retweeting our videos until they see one of them.
Yeah. Or send them a video.
Sending is a bit more direct, but like you can repost,
Repost.
share, like, comment,
Yeah.
and the more you do it, the more our channel grows and the likelihood of them seeing it increases.
And the likelihood of your friends saying, hey, dentists are not bad people. And they're not. Like, honestly, I hang out with so many dentists, I'm even going to hang out with dentists tonight. They're not bad people, trust me. And yes, sometimes they make questionable decisions, in their personal life, in their practices, but they're only human, just like you. And they want to make you feel better. So, if you're too far away to come see us, you can come on guys, sorry.
Yeah.
You can see there's so many dentists, great dentists across the country that
It's not too far. We have patients from Pumalanga, Limpopo, coming through Northwest even. So
No, I'm
Make
just
the
saying.
trip.
I'm just saying. I'm just
it's
saying.
worth it.
And it is worth it. Like, I sleep dentistry, I eat dentistry, I live dentistry, I breathe dentistry. Everything is dentistry in my life. I've got teeth on my clothes, I've got teeth on my bed, I've got teeth.
Okay, I don't know if I can say that.
I'm joking. That was a lie.
Oh, I have a sick aftershave on, so that could work.
But yeah, so hopefully we can, navigate dental conversations and health conversations with family and friends in a healthier way. And if, you do see this, if somebody tells you something, please don't feel offended. Like, really, they could be doing you a favor.
It was probably harder for them to
Yeah.
say it than for you to hear it.
Indeed.
Because it's a very hard thing to bring up to someone. So take it well.
So if your partner says, your breast stinks, I know it sucks, right? And at that moment, it's like,
Can't be mad at a fact, baby girl or baby boy.
but go to the dentist,
Go see a dentist.
And then after that, if your breast still stinks, you're like, hey, I went to the dentist. What you want me to do? Probably your airway.
Okay, we should wrap it up before we... But thank you for joining us. We'll chat next time. And no one commented the last time, but like, what do you want us to talk about next? So do it. And I'm gonna ask one of those patients who are like, I saw your video. I'm like, you didn't comment, honey. What's up? Don't be asking me for no discounts if you can't even like. Not that I would give it or subscribe, but I might consider it. So cheers, enjoy the rest of your weekend. We will chat again later.